Hello, and thanks for tuning into this session of Getting Care During COVID-19. We'll give others a few minutes to join. So just if you can wait with us while we wait for everyone to join, that'd be great. We're really excited that you're joining us today and that we can answer your questions about COVID-19 and getting care. The most important thing for you to know is that HAP is here for you, and we're here to help, and we look forward to answering any of the questions you might have. We'll just take a few more moments here while we allow people to sign in. All right, well, we'll get started here. Hello and welcome to our Facebook broadcast sponsored by Health Alliance Plan. I'm Steve Selinksy. I'm Health Alliance Plan, or HAPS, Vice President of Product Strategy, Marketing, and Community Outreach. And I'm joined today by Dr. Peter Watson, who is our Vice President of Care Management, Quality, and Outcomes. And Dr. Watson is also the Medical Director of HAP and HAP Empowered, our Medicaid subsidiary. So welcome, Dr. Watson. We appreciate you joining us.
Good morning. Thanks, Steve, for hosting me this morning.
Yes. Well, we know that for those individuals who are joining us, that they have a lot of questions. They want to find out, is it safe? What should they expect when getting care during these times of change here? And we know that a lot of you have questions. We've prepared some ourselves, and we'll be going through them. But if you have questions today, we would love to try and answer them. So please feel free to put any of your questions in the comment section right below here to me. And we'll make sure that those questions, if not answered during this podcast, are answered and put out on social media for everyone. So with that said and done, Dr. Watson, any opening remarks you'd like to share before we get started?
Yes, Steve, I think this is a very important message that we want to get out to all of our members that we support across Michigan and Health Alliance Plan. This has been a very challenging time for our local community in Michigan, and our community has risen to the challenge, but it's very important that our members understand that we are here to really help them make sure that they make the most of the benefits that they have through HAP, and that they're doing all that they can to really safely promote and support their own health, and for us to help them navigate through these challenging times. We're very fortunate that we have partnered very closely with our local physicians and health systems to make sure that they are taking all the steps they need to provide safe care to you for the services that you need. And we want to make sure that you are empowered to really take care of your needs this year so that you can have a long and very supportive healthcare experience.
Sure. Well, and I know, Dr. Watson, whether it's our Medicare members, our Medicaid, HAP Empowered members, or our group members, everyone, went into this thinking that maybe it was going to be more short term than it's turned out to be. And so things continue to change. And we've seen some things go back to what we were accustomed to, while other things have made, haven't quite made it there. And more than likely aren't. And I think we're seeing a lot of things that have been put in place that are probably going to stay the way they are, at least for an ongoing basis for the next few years, if not even more than that. One example I have is where you go to the doctor's office and you're accustomed to going in and sitting in the waiting room, maybe grab a magazine or something like that and read it. And now it's you pull up, you call from your car, they bring you in, they see you, you exit. And that time within the office is, the time you spend is really in the consultation room or exam room, and you're not really spending any time out in the open areas. And from what I see, or from what I hear, at least from providers, that's probably going to become something of just a regular practice going forward.
Yeah, I do think we're going to see what we have learned this year from COVID persist in some of how we manage medical practices for the longer term. Obviously, March through the better part of April and May was an extraordinarily challenging time. And as we got into the summer, some of the restrictions relaxed a bit. But a lot of practices and hospitals have, I think, for the long term, have changed the way that they do things, which I actually think will help us meet future challenges when it comes to future epidemics or infections that may hit our community, and actually keep patients safer over the longer term. We've certainly seen lots of changes with greater adoption of telemedicine and other technologies to promote access to care. And we've also seen opportunities where hospitals have paid an even greater level of attention to infection control and environmental cleaning, as well as practices. So these are actually going to be positive things that I think will actually promote a better healthcare experience over the longer term, even as we come to, hopefully, if we come COVID successfully, we're going to be better prepared to meet the challenges in the future.
Sure thing. So I think we're ready to start with our questions, and we're going to address a lot of stuff. I definitely want to spend some time on the telemedicine and the virtual care as we get further in. So we'll start here with some of our first questions. So I know if you're like many of the individuals that I talk to on a daily basis, they know I work for HAP. They come up to me and they ask me this question on a regular basis. What is safe in terms of a doctor's visit? What doctor visits are considered safe? And what would you have to say to that?
Yeah, I think that, first of all, I want our members to know, and for people in our local community to know, that physicians and their practices have taken a lot of time and thought and investment in their own practices to make all office visits safe. So my answer to that question is if you feel that you need to see your physician for an urgent medical issue, or even you feel more comfortable meeting with your physician to tackle an issue that you are challenged with, you should feel that that visit is going to be safe. And I think that uniformly across our network, physicians are doing everything that they can to work with you on an individual basis to make sure that every visit is safe.
Sure. I know I've had to visit not only my primary care doctor, but other providers. As I mentioned earlier, the new systems and protocols they've put in place, I felt very comfortable and felt that there was definitely some enhanced safety protocols put in place for that. And I guess I would say if you're a patient and you still just don't have that comfort level or aren't ready to venture out yet, as you mentioned earlier, there are the telehealth and virtual care capabilities that many providers have put in play that allow you to still have that one-to-one consultation with your provider.
Yeah, absolutely. And I think that, again, something that's going to make our health system better after COVID is just the rapid acceleration of improvements that we've had in this technology and in physicians who are already adopting this, really expanding their adoption of telemedicine and telehealth to support their patients. This is actually, I think, going to have a lasting effect in promoting greater access for all of our local community members to access their physician. And for those visits that really don't involve a hands-on exam, or maybe can involve just a conversation and a visual connection with a physician, telemedicine offers a very safe and very effective alternative to a physician-patient interaction. And in some cases can be much more convenient, give you the answers that you need to the issue that you may have. And if the telemedicine visit doesn't offer the resolution to the issue that you need with your physician, either you or more likely your physician may say, you know what, we were able to make it this far in the telemedicine exam. I am going to need you to come in maybe for a brief visit or an extended visit, which may involve a physical exam and that sort of thing. But then it allows patients to be spaced out so that there isn't so much crowding in an office and people can still get the access that they need.
Yeah, I agree. I think it's very important that those who are participating in this podcast right now understand. If you haven't been to a provider's office in the last few months, you will not be going back into a crowded waiting room. Once again, they've taken a ton of precautions. It's more so you contact them, they call you back, they have you come in. You come in and they escort you right away to the room that you'll be interacting with your doctor. And then once your physician is done, they'll escort you out of the office. But everything is done in a manner in which you're not interacting with other patients in a waiting room type environment that we had been accustomed to prior to COVID.
Yeah, and the only thing I would add to that, Steve, would agree with everything you said, is that physicians are really thinking thoughtfully with their office staff about how to best meet your needs for the issue that you have. So
Right.
you may get direction from your physician to say, hey, this may be better handled in a phone call or a telemedicine visit. Or no, we really need to see you in the office. So again, work with your physician to make sure that they are meeting your needs. And I think they're going to be very thoughtful about what needs to be in the office or not. But if you come in the office, I want to reassure our members and people that may be listening that I am very convinced, as our HAP staff, that our doctors have used a lot of effort to make all those visits as safe as possible.
Sure. All right. Well, as we move on to our next question, want to make sure that if you are joining us today and you have a question, feel free to put it in the comment section right below, and we will do our best to get to all questions. If we don't get to your question, we will make sure, though, that we do get answers in reply back to everyone. All right. So this is a really good question, and I actually was someone who was a little reluctant about going and getting this type of service. But I had to, unfortunately, get a crown. And so, a lot of members are saying, outside of just their normal primary care, what about dental procedures, eye exams, and some of those other services where your doctor, the provider is becoming, much more closer contact with the patient?
Yeah, and Steve, this is also a very good question because we did see a very steep decrease in the use of dental procedures in particular earlier this year due to COVID, understandably. And I want to reiterate the importance of good dental health for all of our members and people that are listening. Obviously, we want you to connect with your physician for regular health maintenance, but good dental health and oral health is extremely important to long-term health, particularly for those with chronic conditions and for high-risk populations. Women who are pregnant, young children, we need to make sure that you're going in to see your dentist and make sure that you are getting the services that you need. That includes our older patients and other folks with eye issues as well. You need to get good optical exams, particularly those with chronic conditions like diabetes. Having said all that, the dental community has been extraordinarily proactive in making sure that their practitioners take additional precautions. We all know, if you've been to the dentist, that you have a dental hygienist or a dentist that's very close to you over a long period of time with your mouth open. That is, in essence, a higher risk situation where things can get moved back and forth. Dentists and dental hygienists and their specialty societies have a large number of guidelines to help guide their practitioners to make sure they're taking all of the necessary precautions. That includes extra protective equipment, partitioning of the offices to make sure that folks who may be getting procedures at the same time are properly separated. Lots of work has been done in dental offices around ventilation and other things to circulate air. All of those measures are put in place to make sure that while you are there getting a procedure, which I know most folks don't like to go to the dentist in the first place, that you actually have an even higher level of protection than you would in a standard, maybe medical office visit. So a lot of work has been done by the dental community, and same in the optical community for eye exams. That's a little bit of a lower risk transmission, but nonetheless, you have a practitioner that's close to you, examining you. Usually it's not as prolonged as a dental exam, but they are also taking the necessary steps to do prevention so that you're safe. But I really want to reiterate the importance of these disciplines in your ongoing preventive health. Dental and optical are extraordinarily important. So we want you to engage with your dentist or eye care professional to make sure that you're getting that work done.
Sure. Yeah, and I applaud, especially the Dental Association, for everything that they've done, protocols they put in place. You know, when you, at least my experience, when I went into the office, my temperature was taken. They had me clean my hands right there, sanitize my hands right there on the spot. They actually gave me my own mask to wear. I went into the procedure room. The hygienist and the dental assistant who came in, they had all kinds of protective gear on. Not only did they have a mask, they had a shield above them. They wore, protective eyewear. So I felt very comfortable that I felt a little uncomfortable for them and that they had to wear all that, but very comfortable in the from the standpoint as a patient that they had taken the proper safety precautions. And once again, in my particular case, my dental office also made a point to go over with me that they had enhanced ventilation and some of the things that they had put in place since the last time I visited. So I agree with you. I think it's not only ensuring you're keeping up with your primary care and well visit, but that the dental and the eye exams are critical too, because they impact our overall health. And it's so important that you don't let something like that go for an extended period of time.
Absolutely.
All right. All right. Let's see what our next question is. So we talked a little bit about this, but let's maybe you can talk a little bit further. For the members that are wanting to know about going to the doctor, what can I expect with an appointment these days?
Yeah, so Steve, we covered a few of these things, but just to sort of walk through what an appointment may feel like when you come in, and this would be for a standard medical appointment. Few things I would ask our members and folks listening to think about when they're engaging with their physician. Number one, be patient with the office staff. The office staff of our physician clinics are working very hard to sort of triage and make sure that people are coming in for the right visits at the right times. And so they're going to be asking your flexibility. Would you like to do a telemedicine visit? Do you feel like you need to come in? That is not an indication that they're not interested in seeing you. They're trying to gauge your needs with the safety of the rest of the patients coming in. Number two, you want to think clearly about what you're hoping to get out of that visit or engagement with your physician. So if it's really just a counseling issue or something like that, be clear with the office staff when you're calling so that they can really meet your needs. And don't be afraid to let them know, hey, I would rather see my physician. That's okay too. You should really state your preference up front of what you think would be best. If seeing your physician is what the appointment is going to be, in general, you may pull up to the physician office. They may ask you to call when you arrive in the parking lot and have you wait a minute or two. They may be waiting for a patient that's already in the waiting room going into the office because they're trying to make sure that folks aren't congregating in a waiting room. It's perfectly okay if there's someone else in the waiting room when you arrive. Most offices are putting spacers out so that you know that you're 6 feet apart, and they're taking measures to make sure that you're separated. Once you get to your appointment, sort of what Steve described with his dental visit would be similar for an office visit. There'll be some screening questions. They may ask you that over the phone, or it might be placed on the door when you get to the waiting room. If you've had fever, if you've had symptoms related to COVID, you may be asked to wait or talk to somebody before you enter the office. And then probably hand hygiene and other things. Usually folks will have hand sanitizer in. The office staff are doing that. They may have you do that. That's not only for your protection, but for theirs. and then you'll sort of proceed through your normal office visit. You'll probably already be masked if you're coming in from the community. If you're not, practices will typically have masks to offer you if you need to exchange some masks. And then your visit will go as planned,
Oops.
which will include probably checking
Dr.
out
Watson, it
students.
sounds like your audio might have broken up a little bit. If you wouldn't mind just repeating what you said here in the last few seconds.
Okay. So as you're in your office visit, you will probably then be escorted out, maybe out through a different exit, so that patients are sort of moving in one direction in and out of the office. And again, that's to sort of keep patients separated during an office visit. So please make sure you're taking cues from your office staff or your physician about where to go or what to do, and have faith that they're doing that because they're not only protecting you, but they're protecting the patient that came in just after you or before you and the staff. So those are sort of some things to expect, and allow a little extra time before and after the visit, knowing that these precautions add a little bit of time to the typical visit.
And I would say too, if you have any questions of what's going to happen when you do call the office, feel free to ask them. They'll walk you through and let you know. I'd say the biggest thing for me has been not necessarily, it seems like everyone's following similar procedures on the arriving, you're in your car, you call, they bring you in. It's when you leave the office that seems to be different based on each type of provider, their office setup, their structure, their staff. Some will have you still stop at the window and the staff is enclosed or behind some kind of plexiglass. They'll have you take care of your payment or set up, pick up your script or anything there. But then I've been in other offices where you leave and you go to your car, and from your car, then you call in and do all the follow-up with the office team. And in one situation I left and they emailed me everything, and I looked at that once I arrived home. So, it's going to differ, but for me, that was the biggest difference in some of the visits I went, was what happened after the visit on my way out of the office. And in a lot of cases, you'll see, just like you see in the grocery store or somewhere else, they'll have the pathway marked for you. You'll know where you need to go. But
That's right.
Yeah, I would just echo that they've really had it thought out very well, and that when you go there, they'll make sure you're in good hands and take care of you. All right. So if you haven't had an opportunity to ask a question and you're joining us and you have a question for us, feel free to put it in the comment section below. We'll do our best to answer all our questions. And if we don't get to yours, just know that we will follow up after the session today and make sure that we get you an answer. So this is a specific question we've had from some of our members that have some impairments. I'm hearing impaired, and masks make it more difficult. Any suggestions?
Yeah, so I do know that this is a difficult issue, particularly when you're trying to speak with your physician or someone in the office and their mouth is obscured, and so you sort of have a difficulty either because you're wearing a mask and that's interrupting your hearing, or your ability to sort of interact with someone. I do know that some practices are actually working with clear visors or clear masks in order to do that. What I would suggest, if you're seeing your physician, and often if you've been seeing your physician for a while, they're going to know which of their patients have issues with hearing versus others. Let the office staff know, hey, I really need to be able to see people speaking to me, and they may make some adjustments in how they visor or how they protect themselves so that you are still seeing their mouth and things when you're hearing. If the mask is interrupting your hearing for some reason, they may be able to offer you a different mask when you arrive. But again, this is part of your pre-visit preparation with your physician to let them know that that's a need that you have. And I'm sure that your physician is going to work with you to make sure that you're understanding what's being told you.
Sure. And I would actually also add something to this, Dr. Watson. And this actually happened to me with a family member. family member was actually in a hospital setting, and she's older and had hard time hearing, and people, different people throughout the day coming in and out of the room, asking her questions, and she didn't understand, and she didn't want to um, make them go out of their way, to do anything different, and felt a little uncomfortable asking them. And so we, as the family, finally brought it up to one of the head nurses, and they were like, "Oh, by all means, don't feel uncomfortable. If this is new for all of us. Everybody has had to adjust to wearing these masks and doing their jobs. So I would say, if you are someone and you're in a situation where um, you aren't able to understand someone because they have the mask, and you're hearing impaired, um, they understand. And so please, just ask them, or make them aware that you're having a hard time understanding them, and they'll work with you. If they don't know, they can't help you. But this person in our family, she didn't want to want any of them to be inconvenienced, but it's really important because they need to understand um, the type of care that they need to deliver to you. And if you can't understand them, that's definitely an impediment. So they were very gracious and worked, put a different protocol in
Yeah, I
place.
really want to reiterate that. I think you really have to advocate for yourself a little bit and let folks know if you're not hearing. And I can understand that a patient may be concerned that they don't want to bring it up because they think the only option is somebody's going to take their mask off. That's not the only option. We have other ways to protect you so that you are still able to interact. And to Steve's point, which I think is a good one, we are all learning during COVID that has changed the way that we practice medicine and the way that we deliver care. And it's a learning process. And I think that physicians are really trying hard to get better at this and to learn from it and to meet your needs. But please let your healthcare professional know if there's a barrier to you understanding the care that you're getting.
Right. All right. Let's go on to our next question. Um, in terms of the higher risk type situations, you need a care right away, and so you go to an urgent care center or you go to a hospital. There are more individuals there than just your normal provider office, and I have a lot of people ask me this one too: are urgent care facilities and/or hospitals safe?
Yeah, this is extraordinarily important. And I would say that each healthcare setting has taken the maximum precautions that they can take. I'll sort of handle urgent care and hospitals a little bit differently. Urgent care centers are really doing all the same things that medical offices are doing. And in fact, because urgent care centers know that people who are coming in may be a little bit more prone or a little bit more high risk, that they're actually even taking a little bit of extra precautions and making sure that people know at the door, because they may be coming in with a cough. They may be coming in with symptoms. They're really taking the extra steps to make sure that they're triaging, getting somebody into a different part of the building quickly if they're really sick, so that they're protecting other folks. So I know that the urgent care community has been watching this very closely, and urgent cares have been on the front line and doing a lot of testing and other things. So they've actually gotten quite a bit of experience in how to route patients and keep them safe. Hospitals. Hospitals, of course, have been on the front line with COVID since the very end of February, the beginning of March in Michigan. And hospitals have taken the maximum level of precaution to really keep people safe within the hospital setting. The vast majority of hospitals are now routinely testing patients in the emergency room if they're going to be admitted. So we actually know the status of those patients when they get admitted from the emergency room pretty quickly. And if someone has COVID, they've already established areas of the hospital where those patients with COVID can be kept completely separate from the rest of the population. So if you're coming into the hospital for a planned procedure, for an elective procedure, there's going to be an extraordinary amount of preparation leading up to that procedure. Let's say you're getting an elective joint surgery. for a knee or a hip or something like that, there will be an extraordinary amount of pre-procedural testing for you, clarity among the staff that are taking care of you about where you can be and what care you can get. And if you're COVID negative, that you're separated from any small population in the hospital that may be COVID positive. If you're coming into the emergency department, and we do want people to seek out emergency care when they have urgent issues like chest pain or stroke or urgent emergent infections that can't be cared for in another place, we don't want you to stay home. We want you to seek that higher level of care. Emergency departments have already done layered protection at the front door to make sure that people are screened, rapidly tested, put in areas where they can be separated. And if you require admission, as I said earlier, you will be put in a part of the hospital that's separated from someone who would be COVID positive. So I think the level of preparation and layered protection in both urgent cares and hospitals is even more so above and beyond, because they're seeing a different type of patient.
Sure. You mentioned earlier about the hip and knee replacement. I know back in late May, early June, we were hearing a lot of members or people that needed those types of procedures say, well, maybe I'm going to put it off for a year or two. I'm not sure if now's the time for me to go in and have that type of procedure done. And I guess, what would you like to share with members who might be in that type of situation in terms of, are we seeing more and more people now getting those procedures again, and are things more back to a normal state than they were a few months ago?
Yeah, thankfully, I think that really most of our hospitals are returning to near their pre-COVID levels of procedures. Certainly for emergencies and other things, that never really stopped. We want people to come in and get those emergent issues managed. For people who have a more urgent issue that requires elective surgery, I think all of our systems, health systems locally, have put all the necessary protections in place and the staffing in place to meet the demand, not only the current demand, but even to some extent the pent-up demand of people who delayed care for obvious reasons in the spring when things were very busy. Our COVID levels in our local hospitals have remained at a very manageable level, to the point where patients with COVID who are still being treated on a regular basis are safely partitioned from the rest of the hospital population. This is why community masking and all the things that we're doing locally here in Michigan is so important, because it helps maintain those hospital levels of capacity for the emergent issues and the regular elective issues that we all know you need as far as elective orthopedic surgeries and other things that are planned. So the capacity is there. The hospitals have the protective layers in place to separate you from folks that are getting COVID care. And we want people to take advantage of those clinical procedures if they're necessary.
Okay. So would you agree with me, for some of the relatives that I have that like to be their own self-prescribers, their doctor has told them they need this type of procedure done, and they've said, oh no, I think I'll wait. I can wait a little bit longer, hold it up. At a minimum, they should reach out to their provider to
Yeah.
discuss their decision, and what the next steps would be. Just don't ignore it or keep putting it off, because some of those things could get worse if you let them go too long.
Yeah, Steve, at a minimum, I would say that those folks need to continue to talk to their physician. They may want to delay for another reason outside of COVID. Maybe they're going to get better, therapy may help, or what have you. But they need to continue to engage in that conversation with their physician. And I do want to assure our members and folks that are listening that, again, as we've talked about earlier in this podcast, that really physicians have taken the necessary steps to keep you safe. And they will let you know if they think something needs to be delayed for some other reason. So continue that conversation. Have trust that the system is really doing all that they can to protect you.
Great. All right, let's see what we have here. So we talked a little bit about virtual care, and I think this is really important. We have, especially um, with our HAP membership, a lot of our members who haven't become experts when it comes to technology. They prefer that face to face, but we're moving into more of a technology based era. Um, you know, if they haven't tried virtual care, they're still hesitant. What do they need to know about it?
Yes, Steve, I think, again, this is one of the things that we've certainly learned from COVID. Telemedicine was around well before COVID, and we had HAP members and members of the community that were using telemedicine at a much lower rate when COVID hit, and folks had to change the way that they got care. It actually has dramatically accelerated the technology already in place, and it's gotten much better in a very short period of time. Again, physicians are learning and the tools are getting better almost on a daily basis. The amount of telemedicine that we have seen delivered went up dramatically in the spring and early summer. We are still at levels well above use prior to COVID. So some of that change has continued. I think what folks need to understand about telemedicine is that, first of all, physicians are only going to deliver care through a technology that's going to be appropriate for you. Physicians are not going to take chances with a technology if they think a face-to-face visit is necessary. So you should never feel that telemedicine is an inappropriate substitute for face-to-face care. However, having said that, there's a lot you can do through a device. A visual exam can be very good for things like dermatology or for counseling or for other things where a hands-on exam is not necessary, or maybe reviewing a lab result or the result of an x-ray. Doesn't necessarily require you to come in for a visit. What you can expect is that you have to have a little patience with the technology. You heard a few glitches earlier here on this broadcast, and so that will happen. You may have some interruptions, some glitchiness with your Wi-Fi or internet connection if you're using a phone or a computer to access. Physicians are still using the technology, but our ability to do things through the device is getting better and better. So I think what you need to know about virtual care is that it is medical care, and it's medical care that's going to be appropriate to your level of need. And again, like with the precautions that are being done for COVID, physicians are only going to render care through telemedicine that's appropriate for you. And if a hands-on exam is needed, they will certainly be the first to tell you, hey, I need you to come in. But having said that, it can be a real time saver. Doesn't require you to drive somewhere. You can sometimes finish a visit within 10 to 15 minutes. That would have normally taken you an hour or two when you wrap in all the travel time, the wait time, the paperwork, etc. And HAP is very committed to making sure that we remove the barriers to telemedicine so that you can get the care that you need, regardless of your needs, so that you can get more out of that delivery of care.
Sure. All right. Well, for those of you who have joined us mid conversation, HAP is here. We're answering questions around getting care during COVID-19. If you have a question for us, please feel free to put it in the comment section below, and we'll do our best to answer your questions. So, Dr. Watson, talking about virtual care, is there anything you might want to say when virtual care might not want to be used?
Yeah, so virtual care has a lot of applications. And one thing I did want to say about virtual care is it can be an incredible access point for behavioral health. So I did want to make that point that behavioral health is a great vehicle for virtual care because it's a great anonymous medium with your provider to get the mental support that you need. And we're seeing tremendous uptake of virtual care for behavioral health. What are some things that we might want to avoid for virtual care? These are the emergency issues: chest pain, stroke-like symptoms, severe shortness of breath. If you think you've sustained an injury like a broken bone, something of that nature, those are all going to require a hands-on exam, and they're likely going to require some additional diagnostics like an x-ray, an EKG, some blood testing. those are circumstances where you really don't want to wait for a virtual visit. You may call your doctor and let them know you're having these symptoms. They will likely refer you either for an urgent hands-on visit or to the emergency room. We don't want you to wait for a virtual care visit for that. The other thing too, obviously, are procedures. So things that require an actual procedure, things like gynecological screening exams, things like that, those obviously would require a hands-on visit as well, where you're face-to-face with your physician. So we want you to make sure that you're thinking about the symptoms that you're having, the needs that you have. If you're in doubt, just call your physician. They will route you appropriately.
Okay. Good advice. Let's move on to our next question here. Does HAP provide any mental health or emotional support?
Right. So I sort of preempted this question
Yeah.
a bit with my earlier comment, but I do want to reemphasize that at any time, but particularly in this time, that behavioral support is incredibly important. And I think that, our members and folks listening may be thinking about people with pre-existing mental illness, but COVID has affected the entire community, and the burden of COVID and all of its effects, the effect on our workplace, the effect on our children with schooling, the effect on just our ability not to socially interact, that can really be a burden. And so we want to make sure at HAP that we're meeting your needs to support your mental well-being, in addition to treating those issues that may have been pre-existing with mental health. So we want to make sure that you're aware, that you're self-aware of things that you may be dealing with. We have a lot of behavioral health professionals within our network. We have online resources on our website to talk to you about just ongoing stressors and issues related to COVID. We do want to make sure that if there's a mental health emergency, that you're seeking out care immediately from a mental health provider, not unlike what we talked about earlier with medical emergency issues. We want to make sure that you're engaging with your mental health provider as best as you can. And again, another plug for virtual care, telemedicine and virtual care can be a great access point, because we know sometimes in this period of time, it can be hard to access your behavioral health provider because there's a lot of strain on the community right now. And behavioral health professionals are uptaking telemedicine and other vehicles to make sure they can reach as many people as possible.
Great. Yeah. And I would definitely say, echo what you're saying. There are resources available to you. I think it's not only COVID-19 that's impacted our lives, just our day-to-day routines, and so much has changed. There's
Right.
been so much change impacting everybody so quickly that there may be a need for many people to talk to someone for that emotional support, and just know that the resources are there for you through HAP, and we're here to help if you need to use them. All right, we'll move on now to our next question. So when I do go to the doctor's office, what should I discuss with my doctor when I have the visit? Is there anything different than what I normally would have a conversation that I should be discussing with my doctor?
I think that in general, we want to promote the same things, but I would like to emphasize a couple of pieces. Number one, we talked about mental health and mental resilience and how people are really doing with everything that's going on. Don't be afraid to talk to your doctor, whether it be face-to-face or through a telemedicine visit, about how you're feeling. How are you coping with things? If you're doing well, that's great. If you're not, if you're having issues with coping, talk to your physician about that. The other thing is that unfortunately COVID has restricted a little bit of our activities that we would normally do under normal circumstances. Thankfully, we've had a pretty good summer in Michigan. We're entering into the fall. That's sort of the natural order of things. And unfortunately, when we have masking and social distancing, we may not be as active as we normally would be. Talk to your doctor about maintaining physical activity. It's important for two reasons. One, it helps promote better mental well-being. Physical activity is a way to mentally cope with some of the stressors that you have, but it's also a very important part of your ongoing health maintenance and prevention, whether you have a chronic condition or not. We want people to be physically active. The other thing is, as we get into the fall, we're going to be talking about the importance of immunizations for flu. So talk and dialogue with your doctor about when the flu vaccine may become available. That should become available here later in September. This is important now more than ever. So making sure that you're doing the seasonal prevention that you would normally do, but certainly because of COVID, at HAP, we are focusing very heavily on making sure that folks get their flu vaccine, particularly in high-risk groups. And then finally, make sure that you're talking to your physician about any health maintenance gaps that you may have, making sure that you're up to date on colon cancer screening, breast cancer screening, screening for diabetes, or managing your existing diabetes. Make sure that you have gotten up to date with any gaps that may have occurred from earlier in the year when you delayed care for obvious reasons. And have patience that might take 1 or 2 more visits to catch up.
Okay. Good information. Yeah, definitely making sure you're having that communication with your provider is key. All right, we have some more questions. How can I renew my prescriptions during this pandemic?
So another great question. And again, this was something that we really learned about and we're able to really enhance our capabilities. So we have really worked very hard at HAP with our other health systems and partners around mail order prescriptions. This is a really great way for you to get prescriptions in a safe way for your renewals. And I think physicians are getting much more adept at leveraging mail order pharmacies so that things can be delivered to your door. Again, it reduces one more unnecessary trip if you don't need to go to the pharmacy or to the store for some reason, and to get it on time and not fall behind. So again, another good thing to talk to your physician about if you're not already doing so is to get your prescriptions through mail order. And we have a number of great partnerships at HAP to help you do that.
I think it's also important to let folks know that if you may have to wait a longer period of time to get in to see your doctor, given the fact that we've been through all this, and you have a prescription that you take on a regular basis and you no longer have any refills, you can either work through your pharmacy and or contact your provider and ask them if there's a way that they can extend that prescription or provide another refill until you get to the point where you can go back into that office. The key thing is making sure you have that dialogue again with the provider and just don't ignore it and wait until you see them and go a period of time without that medication.
And that's correct, Steve. And so as a health plan, we're working with a lot of our pharmacies to do whatever we can to refill existing medications that we know have not really changed. We don't want you to wait until that visit to get something renewed. Please do that right now. If you have a visit coming up and you can time it, that's great, but don't wait to get your prescriptions refilled. Pharmacies have a lot more tools in place to renew your prescriptions and to work with your health plan like HAP to make sure that those get done smoothly.
Great. All right, we have more questions here. This is a good question. Should I get a flu shot this year?
Yes, yes, and yes. We want folks to get the flu shot. I know I already preempted this with one of the other answers, but I cannot say this enough. Flu vaccination is important every year. That message from HAP has not changed. We have promoted flu vaccination for many years. It is extraordinarily important that all of our members and folks listening get the flu vaccine. Any child 6 months or above, and certainly for older individuals or even for younger individuals who have risks. But even now, I know that we have healthy members, maybe people in their 20s, 30s, and 40s who maybe have not historically gotten a flu shot because they think I'm young, I'm healthy, I don't really need to worry about it. Your best protection against COVID indirectly is to protect yourself against flu. The flu vaccine will not protect you directly against COVID, but it will help keep you healthy from a probability standpoint so that you're less susceptible to other infections. The flu vaccine, like other vaccines, is not 100%, but it can dramatically improve your odds of avoiding an infection this year. And so obviously our at-risk individuals, young children, older adults, folks with chronic conditions, they should get vaccinated like they always do. but I really want to plead to any of our healthier members that are listening that we really need you to get vaccinated, not only to protect yourself, but in reducing your chance of getting flu and passing it on to somebody else. And as we wait for a COVID vaccine, which we don't know when that's going to come, we do know that we'll have flu vaccine. So please do your best to get vaccinated and do it early. We're really recommending that the public try to get vaccinated, particularly those at high risk, by Halloween. That doesn't mean that if Halloween comes and goes, you missed your window. You should still get vaccinated. I always tell people it's never too late to get a flu shot, but we want people to get vaccinated earlier this year. So as soon as it becomes available and trying to get vaccinated prior to Halloween, ideally for those in high risk, that will help us weather a COVID outbreak much more effectively as we go into the fall and winter.
Well, and I can say too, the vaccines are out. I've seen them. And if you, once again, if you don't want to set an appointment to go in and get that at your doctor's office, almost every local pharmacy provides them. I was in my local pharmacy the other day. The person in front of me asked for their flu shot. They escorted them over into a little room, and within less than 5 minutes, they were in and out. They got what they needed. I do want to mention too, for our members, HAP is partnering with a number of different community organizations, and we're providing flu shot clinics. So please, watch our social media, go out to our website, because we have continual updates on the different places that will be providing them. And one of the things this year with a number of organizations we're working with is that you can get a shot through in a drive-through situation. So you can stay in your car and get your flu shot without even have to get out. All right, it says right here we're experiencing some technical difficulties, so we'll wait. So we'll wait a moment here and see if we're able to correct those. All right, it looks like things are better. I'll reiterate what I said, or just repeat what I said prior to the little technical bug. You gotta love this age of technology. I think we've all learned, stuff's gonna happen and we just go with it. But what I was saying is that if you're a HAP member, continue to check our website if you would like to participate in any of the different flu clinics that we are sponsoring with our community partners. And a number of those this year are even promoting a drive-through, so you can actually take it from your car. We're actually at our wrap-up point, Dr. Watson. So we've covered a lot of material. I do want to put in one additional plug. If you're a senior and you're a HAP Medicare Advantage member, we are doing a number of events virtually, because we know that you're unable to, in certain circumstances, go out and participate in a face-to-face environment the way that you had before, and just the fact that there aren't a lot of face-to-face events out there. So we have upcoming cooking classes, floral arrangement classes, painting classes, yoga, mindfulness, a whole host of virtual seminars going on, and you can go to hap.org/events to sign up for those. All right, Dr. Watson, once again, I always appreciate you taking time to share with us things that our members need to know. I would encourage those of you who have joined us, if you have additional questions or need additional information, to visit our website at www.hap.org. We will make sure, if we didn't get an answer to your question, that we reach out to you and make sure that we get you an answer. But for all of you out there, once again, HAP is here. We're here to help. And please feel free to reach out to us at any time if we can answer questions on how we make COVID-19 easier to navigate, or just any general questions about your HAP coverage in general. Thanks again for joining us, and we really appreciate you taking the time today to sit down with us and really talk about how we're going to get care during COVID-19. Thank you.
Thank you.